Hi guys, welcome to Facebook Live Friday. I hope you're having a wonderful Cinco de Mayo pre-day. So Cinco de Mayo is tomorrow. Today is May the 4th, which is Star Wars Day. Just say May the 4th be with you really fast and you'll get it. So today I am answering a question from a viewer, Jen Greek. Hi Jen, I will try to tag you in the description, but I'm not sure I can tag people from my professional account, so I may have to just shoot you a link on Messenger. Jen asks, how can I get rid of the little frown lines between my eyebrows because the makeup is starting to crease and it's getting really annoying. So those frown lines are caused by a muscle called the corrugator. And the corrugator is a V-shaped muscle that goes from the top of your nose out across your eyebrows. And when it contracts, it pinches your eyebrows together. And I would do that to show you, but I have Xeomin in there, so my forehead doesn't move at all. Yay! So that is one of the top treatments, is to paralyze the corrugator muscle with either Xeomin or Botox. I use both of those. They're fairly interchangeable. Xeomin is basically a different brand, so it's a very similar molecule. It's also very safe and effective, and it's been out on the market for several years. Both of those neurotoxins basically prevent the nerve cell from communicating with the muscle fibers, so that signal to move doesn't get across to the muscle. They bind pretty quickly, but it takes about a week to take effect. So you'll get the injection in the office, and then after about a week, you'll notice that you can no longer frown. If you've never had Botox or Xeomin, it's a pretty simple process. Most offices, including my office, will do consults the same day. So you can come in, find out about it, and then get treated the same day. The treatment is a few small injections. The needle's very small. It's a 30 gauge needle, so it just pinches a little bit. And then you'll put some ice on it afterwards. The whole treatment takes like literally 30 seconds. I've actually done my own Botox or Xeomin like in the bathroom between patients. Afterward, it will look like you've been stung by a bee several times, and that's just the actual fluid that I've injected. And that will dissipate as your body absorbs the fluid. You may see a couple little red dots where the needle went in, and those are usually gone by the next day. It is possible to get some bruising from the injection just because we are putting a needle in. It's less common in this area. I tend to see bruising more around the eyes or over the forehead. So if you've never had Botox or Xeomin, the whole process is basically you come in, you fill out a medical history so we can make sure there are no medical contraindications. We talk about the areas you want to treat. I go over the risks, bruising, needle marks. Upper eyelid droop has been reported. The medication can actually diffuse down to the muscles that lift your eyelids. I've never seen it. I've never seen it happen in, the half a dozen years I've been doing this and the hundreds of patients I've treated. But just to be super cautious, I do recommend don't work out for a couple of hours right afterward. So after going through your medical history, talking about goals, we do the actual injection, which as I said takes about 30 seconds, and then you go home. And in 5 to 7 days, you notice that it's a lot harder to frown. The skin where the Botox or Xeomin is injected sometimes feels a little funny. If you touch it, it might feel a little bit numb, but it's not really noticeable or bothersome. So that's the whole process, very simple. Now, if you've got deeper lines where the skin has actually become creased from frowning, it's not going to get rid of those lines immediately because your skin actually has a crease in them. Imagine if a shirt was wrinkled and bunched up on the floor long enough, even if you hang it up, it's going to take a little while for that wrinkle to settle out. And your skin's the same way, but it actually will remodel if you continue to get Botox or Xeomin treatment so that you can't frown. Your skin will remodel and those lines will soften. So the difference between getting that treatment now and in a year, it's going to be a very big difference. The other thing you can do to help speed up that process and help that wrinkle settle out is to add a little filler there. And when I do that, I like to do it a week after the Botox so that the Botox has had time to kick in. And the reason is these wrinkles are caused by motion, and if you don't freeze the motion, it's going to just push the filler out of the way. So it's a very simple process. If you're interested in Botox for treatment of the little frown lines, they're often called the 11s, then come on in and see us. Consultations for Botox and fillers are free, and if you didn't know, we have walk-in hours every Friday from noon until 3 p.m. You don't have to have an appointment. New patients are welcome. Just pop in. I do recommend, though, give us a quick call ahead of time. I do take call for the emergency department, and it's possible I could get pulled away. So if you want to come in on a Friday for Botox or filler, you don't need an appointment. Just call us at 440-974-8577 to confirm that I'm there, and I would love to see you. I hope that answered your question, Jen, and if you have any follow-up questions, just shoot me a message on Facebook. Thank you so much, guys, and I will see you next Friday. And as always, if you have questions, we would love to hear them. You'll see our big blue and green graphic posted on Wednesday and Thursday asking for viewer questions to talk about in future episodes of Facebook Friday Live. Bye.